I decided to do the video of the 1 year review of my operation, and so there's many points that I would like to go through, and let's start. So the first one is that I am so happy that I did this operation, because I can see everything. I don't need glasses for anything. I don't need glasses to read. I don't need glasses to work on my computer, to work with my camera. I don't need glasses. Basically, I don't have glasses anymore. So this is something for me that is incredible, because I can live my life like I used to be before 40, that I didn't need the glass for anything. And this kind of feeling is incredible. It feels a little bit like magic, you know, like first you are in a hole that you don't know what to do. You can't do anything because nothing works, and then suddenly from one day to the other you can see everything. It's pretty amazing. To remind you, like it took me 1 or 2 months, I think, to be able to drive in the night, because I on the beginning I used to see a lot of starlight burst, you know, like it would be a burst of light from the lights of the cars, so I couldn't see the car behind that burst of light. So it was a bit I couldn't, because I wouldn't drive if I wouldn't feel secure. So it took, that's what the doctor told me, you just drive whenever you feel that you can see in a secure way, because my eyesight when I went there was like 6/6. It's like perfection. The only thing I would say is that when the light is dim, like it's not pitch black, and you know when it's not pitch black, it's just dim, then I can see some ghosting around the stuff a little bit. It's a bit like would be a watery eye, a little bit, but very little. Having said that, I can see everything and I can read everything, even with the dim light. So, you know, it's just not like sharp. But I could imagine that this is normal, because you can't expect to have the same kind of vision in a very dim light. I can imagine. Having said that, the pitch black I always can see very well when it's pitch black. You know, when you turn off the lights on your, and it's night and you have just a little bit of light coming out, this kind of situation, I can see everything pretty much. So I am back working. I am like taking pictures, I am editing, I am traveling and photographing. I am pretty much doing everything that I always wanted to do, and I had to stop, you know. And it's just, for me, it's magic. I'm telling you, if you have a problem similar to mine, that you are stopped working, stop doing things because of a vision, because go to a doctor, maybe they can do this lens replacement, and then you will see your life will be transformed. That's my experience, okay? Of course, I don't know, each doctor is different, each lens is different. I mean, I have a friend that her lens is, she has one, it's like to read in one eye and to see further in the other eye. So I don't know, it depends what lens you put and, you know, the different outcomes. But I am talking about my experience with my multifocal lens MPlus, Oculentis MPlus. So my experience, it's I have another life, you know. I am very grateful to my doctor that is such an amazing guy and such you know, supportive and giving me the right advices, giving me the right direction, because I'm not a professional. I'm not. So I need someone that it knows what they're talking about, and you know, and can give me the right direction. And when I had the interview with him, I told him exactly my problem. You know, I told him my frustrations. I told him everything. He could see what I needed and give me the right solution, you know. And the solution he gave me is the best thing I could ever imagine, you know. And yeah, that's it. I can read everything. I can read how many minutes, how long I'm talking, 6 minutes 50. I can see everything. I can read far away, medium way, whatever way I can read, and it's just a dream come true. And I would like what my intention is with this video is just to tell people that it's okay, you know. It's okay, and it will be okay. You just need to go and search for your solution, for your, you know, your way. Because what it I think what it can't not happen is that we stop living, we stop doing the things that, you know, fulfill our lives, because we are incapable to see, you know. I think that's very dangerous, in a way, mentally dangerous. For me, at least, was very mentally horrible. I felt really depressed because I couldn't do anything. And I think, like, do things that you love to do is so important, so you can keep your life in a upbeat, you know, in a way that you wanted to have your life. Just finished playing my tennis, and I thought that would be good to talk about sports as well and stuff like this, because before I did my operation, as I told you, I used to wear glasses, a multifocal, and it was a two focal, to be honest. It was to read and to work in the computer. It's about the distance of a meter or so. I would use as well, so if I am in a restaurant speaking to people, in general I would wear every day, all the time. However, the glasses wouldn't allow me to look in a long distance, like to drive or to see a little bit further away than a meter. So for me it was very hard to, you know, just to do things normally. And to play tennis, I would need to wear the glasses that I would wear for driving. Which that glass, that pair of glasses was good, but was not perfect. It was really not perfect. I didn't, some distance I couldn't see. I could only see, if it would be too further away, I would see all blurry, and I don't know, it was just so bad. So before my operation, I ended up playing tennis with my glasses that I used to wear for driving, which was not perfect. I did not see the ball like sharp, and I could see the ball was better than not having glasses, but it was not really perfect. So lots of time I would lose the ball, and I don't know, I wouldn't see the ball where it's supposed to be anyway. And I think think that, and today, that's what I want to talk. Today, I can play, I see the ball, I can serve, I can get the ball goes anywhere, I can see everything. So I am so grateful that today I can come and, you know, play tennis and be able to see everything. And I guess this, you know, it can apply to other sports, you know, that you need to, you know, see, because tennis, the balls are quite small. If it's far away, if you don't have a good vision, it's very hard. And yeah, so I can see everything now. I can play, no problem. It's almost like unbelievable that it's plug and play, you know. You just go there and you know, just enjoy your game. I don't even think that I have done the operation. It's just like there. It's just everything is perfect. After I had my operation and I stopped using the eye drops for after the operation, that you have to, I think it's for 2 weeks or 3, something like this. So I, for some time, I think I used the eye drop Optrex, the one that just basically is just to clean the eye. So I would wear this like once a day, maybe, if I need. So this I did, and I do it today as well. But I think even if you don't have done the operation, you might do that. So sometimes I feel for, I don't know, maybe 6 months, just to clean. They say it's like for just for to clean. You know, these normal eye drops with nothing really inside. There's no treatment. It's just to clean the eye. I would do that once a day, something like that, because I wanted to, and my doctor said there's no problem, I could do that, so I did it. But not when I was using the eye drops after the operation. I only use what the doctor said. So another thing I would like to talk about is the choice I did to do both eyes at the same time. And today, looking back, I think I did the right decision. So basically, I could adapt the lens to the eye at the same time. So I think if I would have done one eye and then start to adapt the vision to that eye with the bad eye without operation, and then a week later I would do the other eye, and then one would be starting the eye drops in a different time, and it would have a different healing time. I think that, I don't know if I'm talking right or wrong, but I think maybe I would feel different, at least in the first month, maybe later not, because I felt that the eye and the brain, they are totally connected, and when you put a new lens and the lens start to adapt, you know, I think it's, looking back, I think I was better off doing the both at the same time, that the both are going through the same process at the same time, and the brain is adapting the vision of the both eyes at the same time. Because I think a lot of times when I would talk to my doctor saying, the one eye is looking better than the other, it's like, and he would tell me, and how is the both together? Because the brain adapts the both visions, you know. And I think this is something that I can look back now and think and realize that actually I did the right choice to do the both eyes at the same time, especially because my doctor said that my eyes were very healthy, so wouldn't be a problem. but it would be my choice. Okay, of course I can't guarantee that it's not going to be a problem. So much that he told me you might need laser. It's very rare, but some people they need some laser after if the image is not, it's a little blurry or something. I don't know, there's something behind. I think this adaptive lens, sometimes it doesn't adapt properly, and then you need to do laser to just a tweak, and then it works. But with me, everything worked perfect. So I think, you know, I think that was a good thing to do. But each case is a case, each eye is a different eye. So when you go to your doctor, you can talk to him about that, and you will see what he's going to say about this. Some doctors, they don't like to do both at the same time. Some doctors, they do. They think there's no problem. So, and in the other hand, at the time it was about the COVID as well. So I don't know if he offered me that because of the whole thing that I said, that you need to do tests twice, you need to, and it's more expensive if you go twice. So I think that was a very good choice, and I am very happy I did that, because I just didn't need to go through twice everything. It's very overwhelming and very draining emotionally, and you know, the energy is very, so it's, I think it was a good choice. That's what I want to share with you, and guys, and I hope you enjoy, and you give me a thumbs up.